You're watching CTOM TV. Knowledge is power. Shannon is wondering, what are false positive cancer test results and what causes them?
Okay, well, all tests, regardless of whether they're for cancer or not, have certain statistics that determine the benefits of that test. For false positives and false negatives. So one of the terms, sensitivity, and that's also called the true positive rate, that tells you the percentage of sick people identified by the test that are actually sick. And so that's referred to as sensitivity.
Okay.
Specificity is the true negative rate, and that's the percentage of healthy people identified as healthy. In other words, not falsely identified as sick.
Okay.
So whenever you get a test, regardless of what it is, always ask what the sensitivity and specificity of the test is. Always ask. If a doctor is going to be prescribing a test for you, they should know that, and they should have that information.
All right. So
and it's going to be different in every situation and every type of cancer.
Okay, but the test itself your doctor will be able to tell you.
Yes, they should be.
The true positive or sensitivity. In other words, the number of sick people who are identified as actually sick is, say, whatever, 90% or. And the specificity, which is the
true negative rate.
The true negative, healthy people who are really healthy.
Yeah.
And is there one other?
There's positive predictive value. That basically is a statistic that tells you how accurate that disease is at identifying sick people with that disease.
Oh, how accurate the test is.
Yeah.
Okay. All right. But those first two that you mentioned, sensitivity and specificity.
They're the ones you want to know. Sensitivity and specificity.
Okay. So whatever it is, whether it's an ultrasound or an MRI or a CT scan or even a PET CT, you want to be asking that question.
Yeah. And a perfect example for if you're looking at, let's say, a mammogram for a lump in the breast, the sensitivity and specificity on that are going to be fairly low. Whereas you look at a PET CT for a lump on the breast, sensitivity and specificity are going to probably be in the 90s,
right?
90 plus.
Versus maybe 60% or so for or less.
Probably
less.
20.
Okay, so small. Mammograms aren't typically used at that much anymore in many countries, are they, for the determination of cancer, and even ultrasounds and CT scans or
ultrasound's come a long ways.
Has it?
Yeah, it's definitely becoming a much better tool.
I guess the technology has improved.
Yeah, you have some pretty high sensitive ultrasound technology.
Well, that's very good.
Yeah.
Still, it can't tell you for sure it's cancer, can it, though? No. But it can tell you if there is in fact a mass there.
Just if there's a lump there, different tissue density.
Yeah. Thank you for watching CTOM TV. Subscribe below and stay informed.